Hello, I'm Dr. Gerald Chodak for ProstateVideos.com. There has been a lot of talk in the lay newspapers recently about the controversy surrounding screening for prostate cancer using the PSA test. The U.S. Public Health Task Force has recently issued a new report summarizing their analysis of all the existing information available. What they've said is that the benefits of screening for prostate cancer do not outweigh the harms, and for that reason, they're recommending against routine screening of healthy men. Now, what does this mean for the average individual? Does it mean he shouldn't get tested, or does it mean that there's something more complicated? And I think the answer is as follows. This is simply saying that there are harms associated with screening, and that the number of people who do benefit in terms of avoiding harm from prostate cancer may be very small or none at all. Each man should then evaluate his perception of this information and his goals and fears in order to decide what to do. We don't screen for many diseases. We don't screen for kidney cancer, for pancreatic cancer, for brain cancer. We have tests that might help find them, though not as easy as the PSA blood test. And the reason we don't screen for those cancers is mainly because no one has ever demonstrated that screening will save lives, that it will actually make a difference. Also, there are harms associated with screening in terms of biopsies, anxiety, death from getting treated, and complications of the treatments themselves. So I think the most important message for the average individual, for a man who's aging, is to understand the trade-offs, understand the risks and benefits, understand the low chance of benefiting and the real chance of harm, and then decide what to do. Some men are going to decide that I don't care. I don't mind that the benefits are low or the odds of benefiting are low. I want to do whatever is possible to help myself. And other men will say, well, at least I now realize that there is a much greater controversy, and in light of this information, the odds of benefiting are not worth it to me to take on the odds or chances of being harmed. More than ever, this is becoming increasingly an individual man's decision, and what's right for one man is not necessarily at all right for the other. Certainly, older men, those with a life expectancy less than 10 years, have essentially nothing to gain from testing, and yet we know many men are getting tested over 65 and over 75. So before your doctor takes your blood the next time you see him or her in the office, make sure you ask whether a PSA is being obtained and have a chance to talk about the advantages and disadvantages and make an active rather than a passive decision. That is the most important message for any man out there who's concerned about this disease. I hope you find this information helpful. Thank you.